So, what if I told you that one of the biggest recent breakthroughs in surgical safety didn't come from some fancy, high-tech lab, but from a car factory, back in the 1930s? It sounds kind of crazy, but it's the true story of how a super simple chart, originally designed to check quality on an assembly line, was repurposed to save lives and millions of euros in the operating room. Let's get into how it all went down.
This is the big question, right? A huge study in France wanted to find out, and it seems almost too simple to be true. I mean, could a piece of paper, a basic chart, really make a difference in the incredibly complex, high-stakes world of surgery? Well, the answer turned out to be a huge yes, and the way they proved it is just fascinating.
All right, so first, before I can really appreciate the solution, we have to understand the sheer scale of the problem. Surgery is, a modern miracle, but it's not without risk. And those risks, they come with a pretty steep price tag, both for patients and for the entire healthcare system. Here's the thing you have to get. It's not just about the cost of some extra medicine. When a patient has a complication after surgery, it sets off this chain reaction of costs that can just spiral out of control. This isn't a minor issue. It's a massive financial drain on hospitals all over the world.
Just think about it for a second. A complication usually means a longer hospital stay. That's more money, obviously. It's more work for nurses and doctors who are already stretched thin. And it means that a bed is tied up that could have gone to someone else waiting for care. And what's worse, the longer a patient is in the hospital, the higher their risk of picking up some other infection. It's just a terrible cycle.
So, with a problem this complex, where did the solution come from? Well, you might be surprised. The researchers looked way outside the box, to a totally different world, industrial manufacturing.
And they found their hero in this thing called a control chart. Imagine you're on a car assembly line. You want every single car door to fit just right, perfectly. A control chart is the tool you'd use to track the tiny little differences in how those doors fit, day after day. It helps you see when something is starting to go off the rails, when the variations get too big, so you can fix the process. It's all about making things stable, predictable, and top quality.
And here's the brilliant leap of imagination. They decided to take that exact same tool and apply it to surgery. But instead of tracking car doors, they would track patient outcomes, things like complication rates or how many patients ended up back in the ICU. The goal was exactly the same: spot any weird variations, figure out why they were happening, and fix the process to make surgery safer for everybody.
Now, this wasn't just a cool idea someone had. Researchers in France launched this massive, really rigorous clinical trial called the SHEWHART study, named after the engineer who invented control charts, by the way, to see if this factory tool could actually work in the real world of busy hospitals. And they were so careful about how they did this. They spent 2 full years just collecting data before they did anything, just to get a clear picture of what normal looked like. Then, in 2016, they randomly split 40 hospitals into 2 groups, and for the next 2 years, the real test was on. So here's how they set it up. It's a really solid scientific design. You have one group of 20 hospitals, the intervention group. They got the control charts. They were trained on how to read them, they had regular team meetings to talk about their performance, and they had to come up with plans to get better. The other 20 hospitals, the control group, they just kept doing business as usual. This setup is great because it lets you isolate the exact impact of the charts.
And this wasn't just about getting a report card in the mail. It was a really active process. The teams would get their charts every quarter, they'd sit down together, look at the data, and ask tough questions. Hey, why did our reoperation rate spike last month? Then they'd dig in, find the root cause, and test out a specific fix. It created this constant loop of feedback and improvement.
Okay, so that's the whole setup. The big question is, did it work? Let's get to the results, because this is where the story gets really, really good.
Oh yeah, it worked. Big time. The first huge result was this. The hospitals using the control charts saw a 3.3% greater reduction in how long patients stayed in the hospital after surgery compared to the other hospitals. That means patients were actually getting better, faster, and going home sooner. And of course, faster recovery also means lower costs. The intervention group also had a 1.3% greater reduction in cost per patient. Now, that might not sound like a giant number, but when you're talking about more than 155,000 patients in the study, well, those little percentages add up very, very fast.
How fast? Get this. Over the 2 years of the experiment, the hospitals using the charts avoided a jaw-dropping 8,910 hospital bed days.
To put that in perspective, that's almost 25 years worth of hospital stays that were completely prevented, which freed up those beds and all those resources for other patients.
And the impact on the bottom line was just as stunning. The total savings for the French healthcare system from this one simple intervention? Over 2.6 million euros. I mean, talk about an incredible return on investment for what is basically just a low-cost data feedback tool.
But here's what I think is the most convincing detail of all. See, both groups of hospitals got better over time. Healthcare is always improving. The control group improved their numbers by 5.8%, but the intervention group, the ones with the charts, they improved by 9.1%. That extra 3.3% boost, that's the magic of the control charts. It proves this simple feedback loop was the secret ingredient.
So what's the big picture here? What can we all learn from the success of a simple factory tool in a modern operating room?
You know, the researchers who ran the study, they summed it up perfectly. They said that making things safer for patients isn't a trade-off with cost. In fact, the very same actions that improve patient safety are often the ones that save the system money.
And this is the absolute key takeaway. For years, the conversation has always seemed to be, well, we can either improve safety or we can control costs. This study proves that's a false choice. Investing in quality and safety is a financially smart strategy. Better care is smarter spending. They're two sides of the same coin.
And that just leaves us with this one powerful question. The control chart isn't new, it's not flashy, it's not AI. It's a simple 80-year-old idea that was just applied in a new way. And it really makes you wonder, what other brilliant, low-cost solutions are already out there just hiding in plain sight, waiting for us to find them?